Gerontology and Normal Aging. Introduction. In this module, you will learn about a specific field of study related to older people. This field is called gerontology. Gerontology is the study of aging. As a part of this module, you will learn about changes that happen to people in terms of their bodies, minds, and relationships with others as they age. The body changes with age. This section looks at body changes. You will also learn about the changes to specific body systems, and you will gain some useful information about how to provide quality care for residents who are getting older. Visual changes. Many visual changes take place with age. People grow shorter as the vertebrae may compress onto each other. The spinal column compresses, the density of the bone decreases, mostly in women. Muscle tone and size decrease, the tendon becomes less flexible, and the cartilage deteriorates. These changes can cause a loss of flexibility and strength, changing the overall shape of the person's body. Wrinkles, drier skin, decreased amount of scalp hair, and a reduction in the level of pigmentation in the skin are all common in elderly. The skin also becomes less elastic. In other words, it doesn't have as much stretch as younger skin. An older person's skin gets thin, making it easier to bruise, scratch, or tear. Older people perspire less, hair becomes gray, and the finger and the toenails grow more slowly. Sensory changes. Many sensory changes occur with aging. Hearing loss occurs. Sounds in the higher frequency range, such as high-pitched voices, are lost first, and the sounds must be louder to be heard. Hearing problems can contribute to isolation, anxiety, and depression. The resident may withdraw from gathering rather than strain to listen. As a direct care staff person, communicating with residents who suffer from a hearing loss can be difficult, but using the following ideas will make your job easier. Make sure that if residents wear hearing aids, they are in and the batteries are working. If they don't wear a hearing aid, you can do the following to communicate. Face the person and get their full attention before you talk. Decrease noises. Speak clearly and slowly. Speak at a lower pitch or your normal pitch. Use pleasant facial expressions and gestures. Remove gum and candy from your mouth. Keep your hands away from your face in case they follow your lips to understand what you are saying. Allow time between sentences and rephrase sentences if necessary. Use a pad or paper to write notes. Vision, like hearing, is another common change in older adults. Normal changes in vision include the ability to close and read, to see close and read. Larger print is helpful. Older person also do not see as well at night. In general, most older adults see better with twice the light that they may have needed in the past. If the light seems very bright to you, it may be just at the limit of what the older persons need to be able to see. Make sure to avoid glare, however, as this will interfere with vision too. Psychological issues with aging. Older people must make adjustment. Often these adjustments are handled without any problems and the quality of life stays high. Less often people struggle. In most cases, experience stress that reduces their quality of life. Older person may feel afraid, confused, nervous, or helpless. Generally, these reactions happen when there is a sudden and unusual negative changes in the person's life situation. When you observe any of these reactions, report them to your supervisor immediately. It is normal for any of us to be temporarily depressed over a loss, and this is true for an older adult. Over time, we adjust, and this situational depression lifts. However, depression that continues without improvement is not a normal part of aging, and it can be quite serious. People who are depressed have a much higher rate of suicide. Because depression is treatable, it is important to recognize its symptoms and report them to a supervisor who can arrange for an assessment. The symptoms for depression include sadness, guilt, a sense of worthlessness, hopelessness, fatigue, tearfulness, weight loss, excessive complaints of aches and pains that have no apparent cause, anger, and still sleep disturbances. One of the things that makes it harder to recognize depression is that it can often occur with other disease or conditions such as dementia, heart disease, Parkinson's disease, stroke, diabetes, and cancer. When this happens, it is easy for people to assume that it is normal for someone with one of these conditions to be depressed. This is dangerous thinking and is not true. Despite having another illness, someone who is depressed should be treated for depression along with treatment for other illnesses.